Dr. Vandana Siroha ma'am, Gurujans, I welcome you all in another intellectual session of Gyan Ganga webinar series. I, Dr. Garima Singh, on behalf of RAV, welcome you all for the today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for the sustenance of this series. Respected Vaidya Shri Devendra Tribhunaji, President of GB RAV, respected Vaidya Shri Rajesh Koteja Sir, Secretary, Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director of RAV. Today's guest speaker is Dr. Vignesh Devraj Sir, MD, Ayurveda, Chief Physician and founder of Sitaram Retreat, Director of Sitaram Ayurveda Private Limited, Kerala, who has joined us today in the 254th episode of this knowledge voyage. Let us begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantari Devam Surar Surarvandit Pad Padmam Loke Chararak Bhayamrityunasham Dhataramisham Vividhashadhinam. Om Dhanvantaraya Namah. Now I would like to introduce today's expert, Dr. Vignesh Devraj Sir, who is going to throw light on the topic, the Ayurvedic migraine protocol. Dr. Vignesh Devraj is a distinguished fourth-generation Ayurvedic physician, public speaker, and wellness educator dedicated to advancing authentic Ayurvedic healing practices globally. As the founder of Sitaram Retreats, he has created internationally recognized healing spaces that combine traditional Ayurveda with the restorative power of nature. Dr. Devraj has spoken at esteemed international forums, sharing insights of holistic health, preventive care, and Panchkarma therapies. Though his widely followed podcast, Ayurvedic Healing and Beyond, he collaborates with leading global experts to promote integrative wellness, mindful living, and sustainable health practices rooted in ancient wisdom and modern understanding. Now, I would like to invite Sir to proceed with the lecture.
Thank you, Dr. Thank you, Dr. Garima, and all the distinguished gurus and Ayurvedic doctors, physicians. And I'm very happy and very grateful for giving me this August stage to speak about my experience on treating migraine. Now, before I talk about migraine, I want to share my feedback where I got to know about migraine. First of all, there was a patient who came in about a decade ago to my center and retreat in Kerala. So she came with this condition that she want to do a panchakarma, and she was just told that please go and do panchakarma. Somebody told her go and do panchakarma, and through a friend she came to our center. And during the initial questionnaire, and at that time I was too young, not so good at understanding all the reading between the lines when a patient is saying. So at that time she was telling, so when we asked what are your presenting complaints, what would you like to really undergo during this 2 weeks treatment? She mentioned, no, I want to relax. I'm very stressed out. My sleep is very disturbed, and I want to improve the quality of my overall health. And then, okay, that is, we understand that your stress, your sleep is disturbed. Now let's go a little more deeper. What other conditions? And at that point of time, she was going through a very stressful transition in her work, and she was a co-founder of a uh, very well-doing software company in South India, which is very well known. And she was going through some transition in that stage, and also this was closer due to her menopause also. So everything was coming together, a lot of things. And she mentioned briefly, I used to get sometimes migraine attack. This was her feedback during the questionnaire. And then she said that her partner said that she tends to snore a lot. There is a lot of sleep apnea, and at night I could see her suddenly she gets up because her nose gets blocked. So definitely, as per the protocol, we looked at this and looked at, okay, maybe there is a lot of kapha that needs to be cleansed. And we did Panchakarma, Snehapanam. We did a very intense Vamana with Madana Phala, and also Nasyam also was done. And then the treatment was done. 6 months later, a new patient comes because of this patient's referral. And she comes back and tells that why, when we asked, why did you come for this treatment? And she said, one of my friend came to your center and she did this panchakarma, and after that, her migraine attack came very less. So this was just a brief referral that came to us. So at that time, that patient did not say that migraine was a severe problem. It used to happen once in a while, just like one small problem that was happening. But then later she told that for her it was like a game changer after doing the Panchakarma therapy. And I want to know if this is something I can also benefit. For me, migraine is a big problem. So that came with like a serious problem, that my migraine is very serious. It makes her completely turn down her life. It's like every time, whenever some important deadline is happening at work, a migraine could come, and because of which she would close the curtains, she would go into a complete isolation for 2 3 days till the whole episode just flares up and goes down, and only then she is able to come back to life. And constantly she's under a fear, when is this going to come, will this create any trouble for me, and all of this used to create a lot of trouble for her. So this was one of the first few cases. Even though you read a lot about Shiroroga, Sardavavedagam, Suryavartam, and you also know about migraine. Maybe we do give Patyaksha Datrayadi Kashayam. Some in North India, they give this tablet called Saina or Rasa preparations, which are doing very well. But that was the first patient after which I went deep into what is migraine. So I have to say, most of my knowledge about migraine, it actually came through my patients rather than any of textbooks. So whatever I'm sharing here, even though I have documented some of the conditions from the textbooks, uh, not all of it I have personally seen it in my patients. I have seen about 60 to 70% of these conditions that I have mentioned in the textbooks. 30 to 40% I have not seen it. It's only there in the textbook. Maybe some other doctors would have seen it. But in my personal expertise, I will talk about these conditions where I have seen. And one of my teacher, Dr. Shankaranguti sir, he used to always say, if you want to be a authority in Ayurveda Chikilsa, you should learn about Jwara Chikilsa. Jwara Chikilsa is like, once you learn Jwara Chikilsa, the art and diagnosis of Jwara Chikilsa, then the rest of Ayurveda becomes a walk in the park for you, because that is the whole software through which you can look at everything. So I was thinking about that statement, and when I look at migraine, migraine has a very similar approach. If you look at the Nidana Panchakam, if you look at the Samprapti of the disease, and if you look at how the lifestyle, the Prakriti and Vikriti, how the Koshta analysis, all of this comes into, we have to go into each and every minute depth of that patient to understand the patient in total and then treat them. So this is my story, how I learned about migraine, and how migraine also taught me a lot about how to actually use Ayurveda in a very holistic approach. And now, maybe the first slide, Sandhya. Yes. So why migraine is the perfect Ayurveda case study? Like, I mean, you cannot say migraine is the only case study, but why I'm saying this is so holistic to understand Ayurveda. When you study how to treat migraine properly through Ayurveda, just like Jwara Chikitsa, this is another lens through which you will be able to understand how to see a person not just as a symptom, but as a emotions, his lifestyle, his past, his eating habits, his emotional stress that are happening. All of this will come together in this. See, now, if you look at headache, people say, oh, I don't want that to be a headache. Headache is a big problem. Everybody comes and says, oh, I don't want that headache to be a big issue. Like in Ashtanga Hridayam for RSS, there is a name called Durnama, because it is so bad. The name itself is called Durnama. And this migraine is something very similar to that. The moment they get it, they are like completely lost. It's like there is a power cut in their life for the next 2 3 days. There is nothing they can do. So that is why Uttamangam Sirastasya Sarvendriyani Chasritaha. So anything that happens to the head, it will impact everything else. So head is such an important part of the body. Like there is also another explanation. Head is like the root, which is upside down for the body. Just like a tree has its root, in our human body, head is the root through which everything else is growing. So here we will understand these three types, subtypes, and the periodicity. Like how often does this migraine come? You will see certain patients when they have migraine, it comes every 2 weeks or 10 days. In some cases, it happens once in 3 months. Some cases, it happens 6 times. So we'll go through all those conditions that were how this migraine, and in this condition, where should we use panchakarma, where panchakarma should not be used. In some conditions, we might have to refer them to a modern neurologist. But another story here that I have to tell. I'm yet to see a migraine patient who's coming to an Ayurvedic doctor for the first time. Most of the migraine patients that I have seen, they have done a doctor shopping, went to an allopathic doctor, would have gone to a neurologist, then would have gone to certain other specialists who have done that, maybe even done acupuncture, and then they will come to Ayurveda. So I wait for that day so that the awareness becomes more and more clear that the moment you see these kind of symptoms happening, when they come to an Ayurveda. And another thing, if you follow Ayurveda, Dinacharya, Ritucharya, Panchakarma, and all of this on a regular style, you don't have to go through migraine. So there are two goals be an Ayurvedic doctor. I always say being an Ayurvedic doctor today means I am the doctor for the leftover patients. I'm sure all of you can relate to that. Because we get a front row seat to see the side effects of what some of the problems created by the side effects of these modern medications are doing. Not that we are against it, it is fantastic, it is life-saving. But on the other hand, certain things are very symptomatic relief. I'll come to that also. Next slide, Sandhya. Now, you see this CGRP era arrived. If you see what the CGRP, so CGRP is a new age. CGRP is it's a gene-related peptide that is released in the brain when there is a trigger. And what this peptide does is, moment you get a pain like a migraine attack, this peptide makes the volume of the pain very large. So it's like, even though it's like, sometimes you are in a very dark room, and the moment you see little bit of light, that you become very sensitive. Let's say you are in a very bright room and suddenly go into a dark room, even though the light can be little less, you're you will not be able to appreciate that light which is very dim, because your sense organs needs to calibrate. So what this CGRP, this peptide, what it does is, it enhances the volume of pain in a person's head. So today we have a medicine called CGRP antibodies. What it does is, it helps to block this peptide being released. So what happens? Their pain tends to release. So this is a new age medicine. And I saw few patients, about 5 to 10 patients who came to my clinic with this condition. And they were saying that it costs about 50,000 per dose, and they have to take once every month. So in a year, they spend close to, let's say, 5 to 6 lakhs. And when I started doing more understanding, how is this medicine helping them? They say that, okay, on one hand, because they are paying such a huge amount, maybe there is also a placebo result that, oh, I'm paying so much, so it should reduce. But they're saying it is not like, it's like a good relief for the amount of money that they are paying for such a small dosage, for taking one medicine like this. And if you look at the research that is available for this medicine, this peptide, you'll see that 1.4 to 2.2, that is the fewer migraine days compared to placebo across 18 control studies that they have seen. And 30 to 50% non-response to first line oral preventives. And if you see 75% drop off oral prophylactics by the 12 months. So that means it is a great invention. Whoever invented that, I have huge respect, because it is a very good, fantastic symptomatic relief. But what I can see is patients are really not accepting it the way it is. And many patients, especially if their socioeconomic status is very high, and if they can afford these medicines, they take it, and I can see it is not really helping. In India, this is slowly becoming more common, but I see this more in Western countries, because in my retreat, we get a lot of patients all over the world, and we see these patients coming with these kind of prescriptions. And sometimes we have reached a level where neurologists from abroad are referring their patients to us, saying that we are not able to help them. Can you do this? Because the previous patients who came to you were really relieved, so we don't want this. Because in foreign countries, insurance pay for them, so doctors don't have the ability to treat them for a long period. So they look for a real solution so that they don't have to keep the patient log too much. So they are very invested to give the right therapy rather than giving what is they are taught. So this is on another hand, you're seeing this kind of shift, but on the other hand, you also see that people are fear mongering. Don't try Ayurveda. This is not healthy. But this is one condition where the modern medicine, I can actually say with a lot of understanding and seeing a lot of patients, that modern medicine has really failed when it comes to treating migraine. They have really not seen, on the other hand, they have done a fantastic, phenomenal job in diagnosing the types of migraine. Now, I will talk about that when we talk about the classification of headache disorders, where they have come out with understanding these are the headaches and these are the types of migraine and these are the contributing factors to this, but they are still not able to give a real solution, so that, and they are also not able to give a real answer why this is happening. So today, for the next half an hour, we will discuss about how to diagnose. We will go from the modern perspective and also from the Ayurvedic perspective. And also we understand about we go in detail about the Ashtasthana Pariksha, the Savida Pariksha, and where to do Shamana, where to do Shodhana, and where not to do Shodhana at all, and all of these conditions. And we will also see how post your treatment, if you are, see, another thing that I have to tell you, most of my patients that I've treated in migraine, because I run a retreat where people come and stay, I have a luxury of overseeing them during that 2 to 3 weeks of stay. So I'm able to give them, supervise what they eat, how they sleep, because we monitor everything. So that gives another upper hand. But at the same time, if you're doing an OPD, you will have to get good at counseling, and so that they are able to have a self-intrinsic motivation to follow the lifestyle that you are recommending them. So I will try to give you both the feedbacks that I see. Next. If you see a migraine patient, you will see these are the 6 causes. A patient with migraine will come with these 6 contributing factors. So once you understand, then it's easy to go through the samprapti. See, you will see on one hand, gut, which we call as the Agni, the Koshta analysis. So if you see Mandagni, Vishamagni, now, and also Amla Pitta, most of the migraine patients, you will see Amla Pitta as a big contributing factor. If they have Amla Pitta, you will also see they will have this. So there was a study which I will talk about. They observed that when a patient is having acidity because of H. pylori infestation, and because of H. pylori infestation, that when the acidity becomes too severe and if their sleep is disturbed, their overall quality of life is not good, that can lead to migraine. So if they have acidity, they are 2 or 3 times higher risk of having migraine attacks. Now, in Ayurveda, we don't have H. pylori mentioned in our textbooks, but we do have Amla Pitta and Krimi Rogas, where these are very interrelated. So that is one way we try to look at it, because Ayurveda gives you a lens. How do I look at it? And if you are able to adopt the modern investigation and use it and look at it through the Ayurvedic lens, it gives such a good perspective, which we are blessed to see a patient in multiple modalities. So this is one area we have to look. And the other one is the sinus and mucosa. You will see a lot of people with Shita Pitta, and especially if they have allergic rhinitis, and if you do a blood test, their eosinophil levels are very high. In these conditions also, they will have a tendency of migraine attacks. But it's not that everyone who has this H. pylori or Amla Pitta will have migraine, but these are triggering factors. Like when we say look at the Nidana, these are some of the contributing Purva Rupas that you will see. Now, hormonal axis, this is another condition. Woman, if there was a study done where it was told when somebody is having thyroid issues, then that could also lead to migraine. But another study came up and said, no, it's not that way. If you have migraine, then hyperthyroidism is a factor that will happen later. So it's like chicken and egg, but irrespective of that, what we have to see is you will see a correlation between thyroid issues and migraine, and some cases even Hashimoto's can be seen with migraine. And also menstrual migraine, closer to the menstrual cycle, certain women during their 20s and 30s, they will complain. Now started tracking my period, so I know that when this migraine attack will come. So those days they tend to get into a fear mode, or they reduce their tendency to get into intense hard work or late nighters. So this, some women are very aware of it, so they track their cycle and go through this. but they say that there's nothing I can do, even taking any, even if I take any antispasmodic, it is not really helping. I think it will be good if we all can mute. Dr. Garima, can we mute all the participants?
Yes, sir.
Okay, thank you. So, menstrual related migraine is another condition that we will see a lot here. And then, of course, stress and manas. So, here, Sattva Vijaya is very important, and terrible anxiety. And most of the migraine patients that you see, they all come with this pattern of being perfectionists. They are like carrying, so one of my teacher, he used to say, most people who have headache, they have the tendency of behaving like a lizard. So if you see a lizard that is hanging to the ceiling, the lizard believes that it is holding the ceiling like a Superman, but actually that lizard is just holding on to that ceiling. So most of the patients with migraine, they have this tendency that I have to control things, I have to make sure things are perfect. So they are control freak, and on another hand, you will also see they are perfectionists. They want everything to be perfect, and the price they pay for that is they go through a lot of sleepless nights, they go through a lot of difficulties, and that is what is contributing to that. Now coming to the neck and posture, sometimes you will see cervical spondylosis. This is another issue that you will see here, and that could also be a contributing factor. And frozen shoulder, and we have seen certain things that are also correlating with this migraine. Sometimes when you go and do a palpitation here on the neck or the back part or in the trigger points, you will see that they will start saying that the tenderness can be so heavy that it really impacts their health. It really impacts. So this is another condition where you will also see correlation with migraine and the neck and posture. Now, if you see this, sometimes some patients say that the patient will not say, the patient's partner will come and complain, doctor, when she's sleeping, she's always grinding her jaw at night, and she's always. And then when you ask them, do you feel any tension here? And they say that yes, I am grinding my jaw a lot, and this is creating a lot of tension. And usually, when you have a tension in the jaw, this will impact your neck and your shoulder, and this will also impact your serous. So that's another problem that you will see here. And then medication access, you will see a lot of medication overuse related headaches. It's another problem that you will see. Some people will be taking NSAIDs. Just now I told you about the peptide antibody, people are taking it, and painkillers over a long period of time. When they are taking this for a long period of time, it will impact their feedback loop. Next. Now, this is the especially if you are working, most of the migraine patients, depending on your practice. However, I see most of the patients come to me after getting an appointment with a neurologist, and they will be coming with a neurologist letter. So, having an idea of this international classification of headache, now what it says, what are the different types? On the left hand, what I have written: migraine without aura, migraine with aura, and chronic migraine. These are the three conditions that usually come to an Ayurvedic physician. Especially, this is what I have seen the most. And also, on the right hand side, you will see menstrual migraine. But I know few patients, I know few doctors who also see extreme conditions where they are able to have the benefit of using modern medicine. Also, they have a doctor in their clinic who also prescribes modern medicine. In those conditions, certain what you see on the right side is also possible to treat. So migraine without aura, you will not be able to see. There is no aura. So when you ask them, tell me about your migraine, who diagnosed it, they would say they went to a neurologist and it was confirmed that it was a migraine. And they would say the doctor told me it is without aura. And sometimes they say that no, there is no aura associated. Sometimes they say the headache is lasting for a very long period. So here you will see if it is more than 5 attacks in the last, it can last for 4 days. And then it can be like a unilateral, pulsating, moderate, severe, aggravated by routine activity. This is another condition. It can happen two times or less than or more. And the other one is they have nausea, like nauseating feeling will come, and the moment they vomit, they feel much better. This is another condition. And you will see that some people will have photosensitivity. The moment they see photos or even sound, there is loud noise or too much of bright light, that also impacts and that also triggers this condition. And then you will see migraine with aura, which is suddenly they reduce that exposure. That will help to reduce that condition. Now, chronic migraine, this is another condition where you usually majority of the migraine conditions that come, it lasts for 2 to 3 days, maximum 48 to 72 hours, and it goes down. But there is another group of patients whose life is extremely miserable. It lasts for half a month, and then it changes, then it comes again, then it changes. So it's like the full moon and new moon time. 2 weeks of their month is very terrible, and then the 2 weeks they feel better, and then those 2 weeks they are afraid when it is going to come back again. So their quality of life is very miserable because of this. Next slide. Now, when when you see these kind of cases, these are the cases, if it comes to you, you have to be very careful not to treat them. At these kind of times, if you do any, even if you do Shirodhara or Vasti or Vamana or Virechana, even though the patient, you can see that they have lot of comorbidities and they are very apt to do Panchakarma. But during these conditions, we have to be very careful. They have to either wait, get an appointment with a modern doctor and let that pain and symptoms come down. Only then we should touch them. Otherwise, what will happen? The symptoms might get triggered, and then the modern doctors are waiting for reasons to say, oh, you see, he went to an Ayurvedic doctor and that is why this has made it worse. And this is in one condition, because this is when the condition is at its worst. At that point of time, no treatment will not help. You have to wait for that onset to come down. So you will see thunderclap onset. It is like a very terrible, it's like a drilling pain, and it's like suddenly it's like the word thunderclap, it's like a lightning is hitting on them, and then it just goes off. But during this phase, if you see patients who are going through this phase, better you have to wait for them, and if they have any modern medication that they are taking, let that, but let them also go to a neurologist, and if they want to get an appointment there. Now, new neurological deficit, seizure, confusion, fainting, and there is a persistent aura. This condition also, we have to wait till it comes down. Any new headache after they turn 50. Mostly we will get patients quite early during their 20s, 30s, and 40s. But if it is suddenly they are getting it for the first time after 50, we need to ask their history. How long have you been getting it? Is this for a very long period? And if they say it's the first time I'm getting, and they are post 50 or post menopausal period in 55, 56, then also we have to be careful. We need to do more investigations. And then you have the systemic and secondary conditions. If they are having any fever, pregnancy issues, any cancer, or if they are taking any, if they had any post-traumatic conditions also. And then you will see progressive changes happening. Then positional or exertional. In this also you will see. Let's go to the next slide. Now, this is where the modern medicine, they have come up with a very good understanding of migraine. So it is useful to just understand, but it doesn't give you the complete picture where this is happening. So there is this cortical spreading depression. That is where the aura phenomena happens in the head. And this lasts for about few minutes, and it's like a wave-like situation that is happening. And the other one is trigeminal activation. This is where the throbbing pain happens. And then before I told you about the CGRP, which is a gene-related peptide. When that is being released, this pain happens. And for this condition, when they give that gene-related peptide antibody, that pain reduces. So this is where vasodilation, neurogenic inflammation, and then the antibodies will also come and it will target that. And then the mast cell activation. This is where you see eosinophils, Shaitapittam, all these conditions are activating. Next. Now, here you will see what this OR, what it stands for is the odd ratio. When somebody is having Amla Pitta or Vishamagni, Manda, all of these conditions, like if you look at it from a modern diagnosis, what you see here is the H. pylori and dyspepsia 1.92, like let's say there are 1.92 is the odd ratio, like every two patients, this is a high possibility that the H. pylori can be very highly prevalent in them. And when you look at IBS, you will see a lot of migraine patients also having IBS as a comorbidity. And then anxiety and depression. This is from the patient health questionnaire. If it is, if they, it's actually 9 questions, and if after filling up that entire 9 questions, if the score is about 10. So what I understood, most of the migraine patients, when they did that patient health questionnaire, especially when it comes to their mental health, 57% of them claim that they are having tendencies of anxiety and depression in a migraine. So when a migraine patient is coming, they are not just coming with headache, they are coming with severe mental health problems. So that is when we need to give them the real Di Dhairyam Atmadi Vijnanam. And it's very good. So if you are a very good doctor treating migraine, that means you have to get very good at giving the right counseling, right guidance, giving them calmness, giving them good confidence. That is very important. And then another condition that you will see, medication overdose, and allergic rhinitis, Sitapitam that we spoke about, and hypothyroidism. So if you look at it, 6 modern specialists for 6 comorbidities. And we look at it from the concept of Agni, Koshta analysis, then coming to Ama, then Srotorodham, and then Kavaigunya at the Shiras. This is how, when we look at it. Next. Now, if you look at this, inflammatory mediators and gut microbiome disruption. See, also made this because once upon a time we had few allopathic doctors who wanted to understand. So we were trying to explain how do we look at it from an Ayurvedic perspective. Does Ayurveda talk about H. pylori? Does Ayurveda talk about how this pain is coming? And they were quite fascinated to understand. This is how we had an understanding of how the human body is working. So if you look at it, the inflammatory mediators, this is what the modern doctors use, gut microbiome disruption. We look at it from Agni disturbance, Mandagni and Vishamagni. Now, HPA axis and serotonin pathway alteration, because this happens as we saw that most of them will have depressive bouts and anxiety related conditions. So there is Ama formation, Jadra and Dhatwagni level. This also impacts their overall energy. Now, trigeminal-vascular activation. This is where they have majority of the migraine happens. So for us, it is Srotorodham. Manovaha Srotas, Raktavaha Srotas, and Annavaha Srotas comes here. And then we spoke about the CGRP release. This is a gene-related peptide release, which leads to severe pain and Urdhva Gati of Vata Pitta to Shiras. That is Shiras Shula that is happening. Next. Now, these are the 11 Shirorogas that is mentioned in Uttarasthana of Shushrata Samhita. So, if you look at this, Pakshadva, Dasharatradva, Tivra Vegaha Pravartade. This was a clear explanation of one of the beginning. If you look at the international classification of headaches, the chronic migraine, which keeps repeating every 10 to 15 days, this is a clear explanation of this, where we can look at it from the concept of Ardhava Bedaka. However, you can look at it Vataja. Where does it come? Severe variable, worse at night, and when it is cold at night. So when I see patients coming from Europe during peak winter, during the months of November, December, January, when sometimes the climate goes to sub-zero, this this kind of migraine also happens, and you will see there is a Vata predominance there. And then Pittaja, there is burning sensation, photophobia, and heat aggravated. This is another type. You will see when patients, if they live in UAE or even the peak summer times, when it is very hot, And sometimes what happens, they stay in an air conditioned room and suddenly they get exposed to this heat or too much of heat, that can also trigger this. And also if they have too much of pitta dominance, that can also contribute to this. And then here you will see kapacha, that is heaviness, congestion, morning onset. This is where you will see shita pittam, where the products that are like haritra kanda, alarkand, this is very helpful. Now sannipadaja, all three doshas are combined. Now, Rektaja, burning redness, and Sparsha Sahatva, they are very, very tender to be touched. Like you will see that their eyes are slightly reddish in color. There could be also be a tendency that they will have high blood pressure in these conditions. Now, usually this happens in men. I have not seen any woman in these conditions, especially if they have hypertension and then the headache will come. Now, Kshayaja, aggravated by Sweda, Duma, Nasya, especially if they are very debilitated, this kind of condition. Now, Krimija, this is again when we spoke about H. pylori conditions, where all the Krimija concepts are coming. This is one of the correlations how we can look at it. Now, you will see Surya Vartam rises with sun, peaks at noon. This is another condition. You will see patients who are saying that they are very sensitive to exposure to sun. The moment they get exposed to too much of sunlight, this also happens. Now you see the word Ananta Vata. It's like the Vata is so anadi, like it continues for a very long period. This is a very clinical condition where their neck posture is very unhealthy, and because of the sloping posture, and they would have cervical spondylitis or spondylosis, and this could also be a contributing factor to that. And they would be using a very thick pillow and sleeping under fan and air conditioned situation, and that leads to too much of Shobha Avastha. That can also trigger this. Usually when you touch that point, you will see this. Now coming to Ardhava Bedaka, which is the most closest explanation that we can see when it comes to the modern explanation of migraine. Most of the patients who come to us, who have visited a allopathic neurologist and coming to us with this classification of migraine with aura, without aura, a lot of it you can see Ardhava Bedakam. See the word Ardha Avabedakam. Ardha means half, Avabedaka. It's like a splitting pain that is coming. Now, Shankaka, this is a very, I have not seen, but we have read it. Next. Now, you see, Ardha Avabedaka. Ardha, it is half. Avabedaka, it's a splitting and piercing pain. Now, what are the clinical features here? Now, if you see in, if you see this Ardhashiras, half of the head is where the pain is there, and it is Vedana, it is splitting pain and throbbing pain. And periodicity, it will be there for Dasharatra, it could be there for 10 days or even 2 weeks. And it is very severe. It's like they have to stop their entire thing. It's like their head has gone into a flight mode. And then sensory intolerance. Sensory intolerance. There could be photophobia or phonophobia. It's like they are very sensitive to anything that is extreme. They become like a little child that they are afraid of anything. Usually they go into a room, put the curtains and stay inside for 2-3 days, and then they just wait it out. And then the variable, what you see here, the Agni is different. So these are the conditions that we will see. Ardhavapedagam, which is a very close, or I would say at that point of time, this is how they understood migraine. Next. Now, Dashavida Pariksha and Ashtasthana Pariksha. See, you all know this, but I want to highlight what matters specifically when it comes to treating a migraine patient. See, in Dashavida, the most underused parameter, according to me, is Sattva. Now, see, Pravara Sattva versus Avara Sattva, this predicts a lot about their compliance for the treatment. So it also predicts about their pain tolerance. It predicts whether your patient will sit through 7 days of, let's say, can we do all the intensive treatment for them? Now, let's say Vamana is a very good therapy. Will they be willing to, yes, doctor, I will do, see, because we all know, being an Ayurvedic doctor, yet I'm yet to see a patient who will come and tell me, oh, I'm so looking forward to do a Vamana. Because Vamana is not an easy therapy. People will struggle and they are not really looking forward. So, but depending on their sattva, we have to be very clear in understanding. But many cases, migraine patients will have a very strong pain tolerance. Otherwise, they wouldn't have created this, because they have a huge stress coping mechanism which actually got them into this place in the first situation. So you need to tell your patient on day one, like, by first understanding, are they a pravara or avara? And that will help to change their consent. And that will also give us a prognosis to what extent we can treat them. See, and also the age, the bias, the age really matters here. See, because of the hormonal axis, in some conditions, especially if somebody is, let's say, post late 30s, this will also have an impact. So we have to understand at what age and what is the sattva. See, all of this is important, but among these, the sattva and vaya, I always give a lot of importance. And when it comes to Ashtasthana Pariksha, for sure, Nadi plays an important role. Mala Mutram also plays an important role. However, Jihwa, it gives a lot of understanding. And to a great extent, we can also see, looking at the coating, you will be able to go in detail about their Koshta analysis. So, Jihwa analysis, I see a lot of thing, and you will see Vibandham. If they have tendencies of constipation, acidity, all of this falls under. So, Ashtasthana Pariksha, I give a lot of importance to Jihwa. And of course, let us not skip the Mutra, Shabdam, Drik, Akriti, Nadi. All of them are very important, but I do give a lot of importance to the Jihwa part. Now, next. Now, please look at this seriously. This gives a lot of clarity, and I have documented how the whole timeline of a patient who is going through uh, a migraine it goes. So, first you will see in the Nidana, Vega Avrodha. Mostly, as I mentioned, migraine, usually you will see it only in a high socioeconomic status person who lives who have first world problems. First world problems means they are not worried about uh, when the next food will come, will I have a shelter to sleep. These are problems of first world problems. Like we can also call it as santarpana vyadis, not apatarpana vyadis, santarpana vyadis, because these are problems of too much in life, and their life is about achieving too much. So, which means they have to compromise their sleep. There is too much of stress, and they are not satisfied. They might have a lot of things money can get, but internally they are not satisfied. So, in such a situation, a lot of vega avarodha can happen, and then because of which skipped meals, late nights, because it's okay for them, they have luxury to eat late at night. And sometimes, because of work also, the work is finishing only very late at night, that also forces them to have late night meals. And because of constant meetings, they skip meals. Now here you will see too much of screen usage. That is also a big contributing factor. Now we have so many results where how screen exposure is also contributing to mental health, and as well as your health of your vision, and also how it can contribute to various types of headache. And then here you'll see Krodha, Shoka, Chinta. Like definitely when they are in a high performing position, they go through a lot of frustration, lot of fear, lot of anxiety. What is the next thing? So getting into these, when you do the detailed medical questionnaire, you have to go through this. And then hormonal shifts. And then if they are taking any drugs or alcohol, all of this contribute to make things worse. And sometimes even coffee in empty stomach, which I'll be describing here, will also contribute a lot here. Now coming to Purva Rupa, yawning, neck stiffness, then there is mood change, and that leads to irritability. Then too much of food cravings, there is bloating, then sleep is disturbed. Like if you see the biggest first sign of a mental health is always impacting the quality of your sleep. The sleep is what is impacted. And then you have Vata Prakopam, and then you have Kapha Utklesham, which is, see, you see Vata Prakopam and Kapha Utklesham. So one thing that is common in both Vata and Kapha are both have Shita guna in this. And one is Rukshavastha, and one has lot of Snigdhatva. So this leads to other problems that is associated with this. Now, when it comes to Rupa, the quality, the throbbing pain, or it is burning, or it is a dull pain. Sometimes the chronic pain can be dull in nature, But migraine with or without aura, that comes for 2 to 3 days. It can come with a lot of throbbing pain, and sometimes you will feel like a burning sensation also. And then the location, it is usually on the occipital region and the temporal region. And then the duration and periodicity, it can vary. And then there is photophobia and phonophobia, and then there can be nausea also. And then the functional disturbance happens. So what happens, Upashaya, they'll say that when I use warm oil, it comes to when they say that this cold wind triggers this, they say that once they get into a warm room, this changes. Or if they are in an air conditioned room, when they reduce it, it changes. So that's a condition where you can look at the vata concept. And if it is pitika in nature, suddenly if they go into a cold and dark room, they will see it is slightly reducing. And dry warmth plus they go through a period of fasting and it changes. This leads to understand that it is kapha in nature. And then some patients, they say after they go to the toilet, there is a evacuation, they see a relief. And then some patients, what they say, I take a sleeping tablet and after that I go to sleep. And some patients, they say I take melatonin, it helps them. Some patients, they say they take tagara, manasamitram, if they have done ayurveda before. So all of this can also contribute to this. Now here you'll see how the Samprati, Dosha Dusha is identified, Srotas, Kavai Gunya, Agni and Ama status, Adhisthana is understood, and then the Sanchara and Urdhvagati. So this one way you can understand how the life of a migraine patient is coming. See, this is a condition which is contributed with daily habits, lifestyle, late night uh, food, not sleeping properly, too much of stress, and all of this. And suddenly, if they have a genetic predominance, this contributes to this. Next. Now, here you will see dosha. Vata and Pitta are the primary doshas. Kapha, if it is on the sinus region or on the cervical region for to some extent. Rekta, if it is vascular in nature and if there is a tendency of hypertension. Now, what are the doshyas? Rasa, Rekta, Majja, and Mamsa if it is cervicogenic in nature. Mamsa, it is in cervicogenic in nature. When it comes to Srotas, we have to give a huge um, uh, uh, focus on the Manovaha Srotas and also Raktavaha Srotas, Annavaha Srotas, Indriyavaha Srotas, depending on their posture, their sleep, their. There was a patient who said they listened to they always kept noise cancellation earphones, and for constantly they were listening, or the earpods, so not the headphones, the one that you see with earpods, which is Bluetooth in nature. And they were saying that because I was using this, I don't know if this contributed, but I could see after I stopped using it or after I stopped keeping my mobile phone near to me, the pain also reduced, or the tendency and the frequency also reduced. Now coming to Amavastha, Jadara Dhatva Agni level Ama mediating to the Srotorodham. See, this Srotorodham is so important. If we can identify where the Srotorodham is happening and if we can go and diffuse this, this is a great way. Now, at Srinkadaka Marma and Pranavaha and Manovaha junction, this is where the Srotarodha is happening. And Kavai Gunya, Siras Uttamangam, Sarvendriya Adhisthanam. It is like, again, this is where it is happening. And Urdhva Gati of Vyana and Udana carrying Pitta Rekta to the upward direction. And where is the Adhisthana? As we also were discussing, it is in the Shiras. Next. Now, we are repeating this conditions again here, but it will give you some idea to each type. In Vataja, you will see dry, shifting, and throbbing pain. Whenever you hear the patient saying it's a shifting pain, it's a throbbing pain, and when you ask them what could be triggering it, they would say that I come from a cold place, or there is a lot of air condition, or there is cold wind, and when I travel a lot, and when I skip some meals. And when you use warmth oil and when they are eating properly, this will help. And when their sleep is disturbed and when they are not going to toilet on a regular basis, and when you tell them, you will see this is a vataja condition. Now coming to the pittaja, it is burning in nature, it is sharp in nature. See, the idea, it's very difficult to get a feedback about the nature of pain. I always ask the patient, when they say there is a pain, I ask them, can you explain the nature of pain? So we have to be like a detective to understand, and you will get better when you hear at least when you start listening to this to 20 to 30 or 50 patients, then you get better at understanding, and they will start pointing here. It will be like this. Some people say it will be here. Some patients will say this part. It is very, and you have to be very good at identifying what are their emotional faces that they are making, where the hand is going. That way we can understand, is it sharp, is it throbbing, or is it like a dull pain where the entire head is bothering. So it's a very subjective, and it comes with your ability to understand. So burning and sharp, it is heat, hunger, spicy, alcohol. When they are take, see, this is again where the amla pitta conditions can also happen. Now, cold, dark, and sleep. When they get into a room which is very cool in nature, when it is dark, and when they also sleep, this also helps. So acidity and menstrual cramps associated. So in all the women where they say that the migraine is severe and has a tendency closer to menstrual cycle, this is pittaja, paitika in nature. Now coming to kavacha, heavy, dull, and congested, cold, damp, and dairy. If they have a tendency to drink a lot of milk-related masala chai or curd, or in the evening at also a lot of curd, and they have a tendency to eat a lot of paneer, like milk, heavy stuff. This can also contribute to that, and warmth and dryness will help. And you will see sinusitis and rhinitis here. Now, vata and pitta, throbbing and burning, both are coming together. You will see a mix. There is throbbing and burning sensation, stress and heat, sleep and cool. See, most of the condition, I'm yet to see a migraine patient whose sleep is not disturbed. Everybody's sleep is disturbed, but to understand the classification, you are able to see it from that perspective. Most common, anxiety and acidity coming together, and anger can also be there. Now, Vata Kapha, dull, heavy, and there is neck radiation, AC posture, and then you will see once they sweat a lot, once they are able to move, some patient they say I went to a chiropractor or a marma therapist and he helped me to release the tension there, and after that I was feeling very well. So that is the condition that you will see. Now, when it comes to Sanni Padaja, it is mixed and refractory in nature and multiple and unpredictable. You are not able to give a clear example, and there is no relief. You have to wait till it goes out. And medical over use can happen, and then multiple comorbidities also will be there. Now, Rektaja, burning and redness, and hypertension, alcohol, heat, cold. Now, here Rekta Moksha can help, and hypertensive and urticaria are some of the conditions that are happening. See, what we can see, migraine without aura, that is Vata Pitta Ardhava Bedakam. And when it comes to vestibular, Vata Kapha Brahma. Now, when it comes to hemiplegic in nature, which is Vata Vyadhi, these are conditions where we will have to refer to some extent. When it is menstrual in nature, Pitta Rekta and Artha Vaha are the conditions here. Now, let us also discuss how Panchakarma, how can we do Panchakarma, where to do Panchakarma. So, this is a condition. If it is an acute attack, mostly we will see patients with acute attack. And if they are at the peak of the pain, and if the pain is very severe, at that time, do not do any Shodhana therapies. Do Shamana, rest, Talam, gentle measures. At that point of time, let us not do any Shodhana therapies. We have to wait till it comes down. Now, if it is not an acute attack, most of the patients who come to us don't come when the pain is severe. They come post the pain, or it could be a chronic migraine where it is fading out after 2 weeks. At that point of time, they will come. But I'm just again for the sake of giving a complete analysis. When they come with an acute attack, at that point of time, let us not try any intensive. Of course, we all know at that time, patient will also not be compliant and they will be very sensitive. But post attack, what we do is when they come and tell us that I used to have it like this, first let's go through the diagnosis. Then high, if it is Paitika and Rektaja in nature, Virechana when they are very stable, and during the Sharat Ritu, then Snehapanam with Mahatikta Kritam is fantastic. Then I've known some doctors. They do Shiraveda and Jaluka Avacharna. I personally have not practiced it, but I've seen doctors who practice this and the patients are getting fantastic relief. But I have not practiced this. But mostly my practice is mostly with Virechana, Vamana, and Nasyam. Now, when it comes to kavaja in nature, when the sinus is very, when they have a tendencies of too much of allergies, too much of mucus, and also when you talk to the patient, they say that when the migraine comes, I have this nauseating feeling that, and after I vomit, it feels better. This is a classical example where you have to do vamana. But in these conditions, when they talk about nausea, and if you see there is a tendency of acidity, then we might have to space and do Vamana and later Virechana, or maybe start with the Mrudu Virechana, depending on the which dosha is creating the biggest problem, and then postly you do that. Now coming to chronic Vata and Krisha in nature. In that condition, Brahmana first, Kalyanaka Gridam, Mahatikta Gridam, Shirabala. In these conditions, Agni Karma is also mentioned. The doctor whom I was referring to, who does Shiravyadam and Jaluka Vacharnam, for him, he also does Agni Karma, which is giving fantastic result. So, underlying Nasya is important, like Nasahi Shirisodwaram. We learn about this. This Nasya plays a central role for all Shirorogas. And about which oil, Anutailam or Shirabala or Shadbindu Tailam, I'll talk about it in the coming slides. Now, here you will see Virechana. On the left hand side, you are seeing Virechana. See, Virechana first, it's a best fit for Pittaja, Pittavata, Raktaja, and menstrual related heat triggered acidity linked. Wherever you see the patient is complaining too much of acidity, too much of heat, they the moment they come to your clinic. So my clinic is in Kerala, where it is very humid and hot, and they will all come with and constantly using a fan, and they look for a fan somewhere. The moment you see this, Virechana is paramount. See the sequence. See, first you do Deepanapasana to correct the Agni, then Snehapanam. Give Mahatikta Gridam for Pitta Rakta Dushti or Kalyanaka Gridam if they are very stressed out. But most of them are stressed out, but you can decide between these two. And then we do Svedana, then Virechana. So I do it with Trivrit. Either you can give Trivrit Lehem, we have Misraga Sneham in soft gel capsule, or sometimes I give Avipatti Churnam. But since there are a lot of doctors from North India, there is a difference between Avipatti Kara Churna and Avipatti Churna. Avipatti Churna is a combination that is mentioned in Sahasra Yogam, where the lavang is less and Trivrit is more, and it is more creamy hara in nature, and it is more, if you increase the dosage from 5 grams to 8 grams, you will get Tikshna Virechana. So there is a difference between Avipatti Kara and Avipatti Churna. So here we are talking about Avipatti Churna. And Misraga Sneham, which is a fantastic combination, especially if they are having signs of Krura Koshta. There to give Viresanam, which is in Sneha in nature. So Misraga Sneham, it is a Sneha in nature. So Snigdha Viresanam is highly recommended. But in some conditions, I also give Avipatti Churna. So this is how you can look at it for the Virechana part. Now coming to um, Vamana part, Kapha predominant allergic rhinitis, when they say that they have too much of nasal blockage, and sometimes they also come and say that they have a deviated nasal septum. The ENT specialist told them they have to do a surgery. In these conditions, you will also see a comorbidity to migraine or headaches or sinusitis. So cold, damp, aggravated eosinophilia is very high. In these conditions, do a proper snehapana and then do a proper vamana. Now, this is one way to look at this. And as we know, in order to do Vamana, the patient, we have to do so what I do, I always do a ECG before Vamana, irrespective of the status, because once you know that the heart health is fine, and if the patient is willing, we don't have to fear about any complications. So what I do an ECG, and I have few doctors who refer this, and I have a very good doctor who I will send that ECG report on the software. Now we also have AI which can read the ECG and give you an idea, but there are very good doctors who can read this and tell you this patient is good to go. We can do Vamana with, without any fear. Many times during the Vamana, this is one area if we can bulletproof that we are in a very safe position, and that is one therapy which no medicine is able to give. That is the power of Vamana. So in these conditions, and in fact, the first few referrals that came to me for severe migraine, and when they told because of this doctor and this treatment, I am able to live a normal life, my severity has come down. In all these conditions, the credit goes to doing Vamana. So Nasya and Shirodhara. So here Marsanasyam give Shadbindu Anu Tailam as Prati Marsanasyam. And Shadbindu Tailam, it is much more stronger and it Tikshna in nature. So in the beginning, we always give Shadbindu Tailam, and as sustaining dose for Pratimarsanasya, I give Anu Tailam in nature. And then you have Shira Bala Tailam. Uh, when there is hypersensitivity, this will help. And the same Shira Bala, it can be used for Shirodhara. In some conditions, when the Pitta is very high, go for Takradhara. So we have done Shirodhara for 2 to 3 weeks continuously, where a patient was coming with severe burnout and migraine together. They are not able to do anything, mentally gone. And in that condition, we did not do any intense panchakarma. Only thing, first we removed the Amavastha, made sure the sleep is better, did Shirodhara, and made sure certain maybe Mrutu Viresana was done, and then mostly it was Shirodhara was done. And then later, when the Bala got better, we did an intensive Panchakarma, and then the severity intensely came down. So we should know when to use Samana, when to use Shodhana. So we should be very good at understanding the Sattva. Is the first of all Sattva and also the Rogi Bala. These two are very important. Like we know that we studied in Saraka Samhita. When you do Panchakarma to a wrong patient, it will cost your fame and it will cost your name. It will cost others coming and telling, don't go to this. So we have to be very clear to understand who are the Arha and Anarhas of all the therapies. Whether we forget to know who is the Arha, but make sure we definitely know who are the Anarhas. That is very important. Next. So here, these are the medications. So when it comes to Vata Kapha, Patyaksha Datrayadi Kashayam. Fantastic formulation. This is specifically mentioned for migraine. So this is available in Kashayam and Kashayam tablet form also. And Yogaraj Guglu and Alarkand. Alarkand is a modified version of Haritra Kandam, where there is Gokshura and Kasisa Basma instead of Loha Basma. Now there is Pittaja, acidity or photophobia. So this APH tablet is Avipatti Kara Churna in tablet form. And Drakshadi tablet can also be given. Now, cervicogenic, and when it comes to thrombomandibular jaw problems, here Rasna Saptagam Kashayam tablet is fantastic, and Flexinex soft gel capsule. This is given for usually cervical issues when there is too much of amatwa here, but Rasna Saptagam and Flexinex really helps here. So we have to understand where these are the contributing factors and prescribe accordingly. You will see the best results. So in OPD conditions, these will be very helpful. And if you see anxiety, insomnia, depressive bouts, Saraswadarishtam, Kalyanagradam, Manasamitram Gulika, and even though they have anxiety but they are ready to do a Panchakarma, Snehapanam with Kalyanagradam is fantastic. Now here, Annavaha Srotas problems, H. pylori, IBS, Vishamagni, Avipattikara Churnam, Indugandam Kashayam, Videsanam with Misraga Sneham, and Avipattikara tablet. Now, refractory and Sannipadaja, Snehapanam, Virejanam, Nasyam, stays with, you have to work with a neurologist because this is a serious condition. See, I've developed few relationship with neurologists from Switzerland and Germany where they prescribe not prescribe an Ayurvedic treatment. They tell this is the condition and they write a letter. Can you do something? Because I've seen this is changing. So usually when they have this episode, they will not be able to take a long flight. But once it calms down, they come later and then you will see a big difference here. Next. Now this Patyaksha Datrayadi Kashayam, fantastic tablet, Shadbindu Tailam. So I always prefer Shadbindu Tailam as the initial therapy, and then later when they go home, give them Anu Tailam. Next. Misraga Sneham, this is in soft gel form. This can also be given for Virechanam. In some conditions, we give Avipatti Churna. Some people, they give Icha Bedi Rasam. Some patients, they give Trivrit Lehyam. In some companies, it is called Hridya Virechanam. The Trivrit Lehyam is called Hridya Virechanam. Next. Now, Alarkand, fantastic for wherever you see eosinophilia, urticaria related conditions, Alarkand is fantastic. Wherever you see eosinophils are very high, IgE, IgG is high in these conditions. Now, I'll do 2 or 3 case studies and then we will wrap up. Doctor, show the case studies. Now, here we have a now here you'll see there is a 38-year-old woman, IT manager, came with the presenting complaints, right-sided throbbing, burning headache 3 to 4 days before menses, and it was lasting for 18 months. And then there is nausea, photophobia, irritability, acidity, and poor sleep. These were her conditions. So she was on sumatriptan, and this is a tablet that helps to reduce it, like 12 to 14 tablets a month, which is actually quite a lot. And that leads to medical overuse headaches also. So, and she's been on this for some time, and even in spite of taking that, the pain is not going. So that is like quite a lot. So modern frame, if you look at it, menstrual related migraine without aura, and it's a high medication overuse risk. That is the condition here. So when you look at it from the Ayurvedic Samprati, Pittavada Ardhavabedakam. Now you can also look at it from Arthavaha Srotas, Rektavaha Srotas, Manovaha Srotas involvement, because there's a lot of stress involved, and Krura Koshta. And then there is Tikshna Agni, Kavaigunya at Srinkataka. Now, what is the protocol? We have to do this is Paithika in nature, because as we saw in the previous slides, whenever you see migraine associated with menstrual related, we have to uh, look at it from a menstrual Paithika approach. So Viresana during the stable time, if it is done during the Sharad Rutu, that is the best. So Mahatikta Gridam Snehapanam. So we started from 30 ml and till the Samyak Snitha Lakshana was done. And then we did Avipatti Churna and was given the Viresanam was done. And afterwards, Shirodhara. Then we did Shirabala with Shirodhara. And then post therapy, APH tablet, Drakshadi Kashayam, and Sarasudarishtam. So after 6 months, 60% reduction in attack frequency. For them, 60% reduction, it's like a difference between life and death. That is how most of the migraine patients come with. So it's not like we are able to reverse it totally, but yes, there are conditions where we were able to reverse it. Maybe I can't say reverse totally, but maybe put them under a proper remission that they didn't have it as it used to be and they didn't have to take any painkillers. But even when the pain came, it was something that is manageable. But most importantly, what happens after we do a proper Shodhana therapy is they start respecting their body's Vegas. They start realizing, oh, I should not be able to, continue my life like this. I should say no to these things very well, and I should not, be unrespectful, disrespectful to my body by consuming unhealthy things, being with unhealthy work culture. So that change is very important. So see, like we have this concept of Satmya and Okasatmya. So Okasatmya is something that is not healthy for you, but your body's tolerance level gets better. Many of these patients who come with migraine, they have normalized an unhealthy habits and behavior so long, they think this is normal for us. And after the Shodhana therapy, and once they see, oh, this is how it means to feel light in my body without that pain, that feeling itself is the beginning of, you know, that recovery protocol. So this is very important here. Next. Now, here in H. pylori associated chronic migraine. So, usually I'm in India, when you ask a patient, can you do a H. pylori test? Not many laboratories are able to give an acute understanding of H. pylori, because there are two ways to diagnose H. pylori. One is through a stool test, and the other is a breath analysis. There are some good laboratories in metro cities where they are able to do it, but and also on one test can cost you something like 6,000 to 7,000 rupees, and you will have to do a breath analysis and get the test result done. And many times it can come false positive. I mean, it can be negative, even though it could be there. So some gastroenterologists, they say that there are two types of patients with acidity. Ones who know that they have H. pylori, ones who don't know that they have H. pylori. This is the kind of explanation the modern gastroenterologists who are treating uh, acidity comes. So usually they give a lot of antibiotics as their first line of therapy. However, uh, see, from an Ayurvedic perspective, we don't have the concept of H. pylori. We look at it from uh, Amla Pittam and Krimija Rogas. That is how we have to look at this. So there was this 45 years old male school teacher, chronic migraine, and constantly in the AC and with PowerPoint presentations and too much of bright light and stress because he's in a very senior position and a lot of work stress is also there. And too much of outside food, severe acidity, bloating, alternating bowel, and taking lot of allopathic medications and NSAIDs, non-steroidal anti-inflammatories. So this patient, because of the access to a very good laboratory, did a test and the H. pylori test came positive and the B12 was also low. So you'll also see an IBS mixed pattern in this patient. So few weeks they have loose stools, few weeks they have constipation. So these were the associating conditions that we will see. So if you look at it from the Ayurvedic Samprapti, Annavaha Srotas Dushti, then Datvagni level Ama, systemic Pitta and Raktaja and condition, Manovahar Srotas, Raktavaha and Sringataga. So the gut is the biggest contributing factor. So how we did, we treat the patient, put them on a very strict diet. I would highly recommend all of you to Google something called nickel-free diet. Nickel-free diet is one of the ways to eliminate tendencies of H. pylori. But however, from our Ayurvedic perspective, Yashti Madhu is a fantastic medication to treat H. pylori. So in this condition, I prescribe Yashti Madhu, APH tablet, and Prana capsule. So Prana is a combination of Yashti Madhu, Ashwagandha, and Amalaki. So this I gave to a very long period. And then once the Agni got stable and then the stress was released, then he came for a Panchakarma and then we did Viresanam also. But just by correcting these three things and helping him to do a lot of counseling, few changes happened. And then later he did a test and then he, according to him, the H. pylori was gone and the acidity levels also came down and his eating factors came on time and we had to force him to quit alcohol. Usually see outside food, alcohol, late night food, and these are the biggest contributing factors for most of the amla pitta that you see, especially in the lifestyle conditions. So these are some of the ways to understand this. Next. Now, this is a classic example where Shita Pitta. This patient, eosinophilia was quite high. So 32-year female graphic designer. So there is a dull, heavy and frontal occipital pain. Now 4 to 5 days a week, it's like when there is a sudden shift, there is a monsoon time, when there is too much of cool breeze happening, it gets worse. Then there is sneezing, neck stiffness, and if she gets exposed to any cold wind, this gets worse. And then cervical tenderness, and whenever you touch them, they will keep their eyes closed like this. Don't touch me there, it is hurting a lot. So in these conditions, we did the bala of the patient was very good. We did good vamana after all the Deepana Pachana was done. And then Nasyam with Shadbindu Tailam. And then we gave prescribed Yogaraj Guglu, Alarkand, and all the Griva therapy. So in these conditions where the patient feels severe tenderness in the neck and shoulder pain, I've seen adopting some certain naturopathy therapies and TCM therapies like dry needling, cupping, and we have this lepam called Marma Gulika lepam, applying it on the neck because this helps to, like in Kerala, we have this word called Neerarakam. Now, in closest modern diagnosis that goes close to this is the myofascial syndrome. So this and migraine can also are very correlated here. So on one hand, Vamana helped. Second, removing the tendency of Shobha Avastha on the neck and the cervical region helps. And by giving these medications, this will help. So again, this patient, see the beauty about once you treat migraine, they are not looking for I want it completely reversed. They all they are looking for is I want to live with this pain because I'm tired of having this pain. I want to live without this pain. So a marginal reduction in the pain itself goes a long way, and they're tired of taking modern painkillers. Next. So what are the patyas? This is very important. So what are the patyas here is sleep before 10:30 p.m., keep a fixed wake-up time, lunch by 1:30 p.m., daily bowel evacuation, pratimarshan asyam with anutailam, screen discipline, especially prior to sleep, 1 to 2 hours, no screen, and pranayamam and yoga nidra. So I give them a recorded meditation to focus yoga nidra, because yoga nidra really helps them to calm down and cool down. So what are the pitta protocols? Cooked vegetables, soaked raisins, coriander, cumin, fennel water. See, this I learned from there was one health coach who came to me with acidity, and she told me, well, it is Ayurvedic ingredients that we talk about: coriander, fennel, and cumins. Because in Kerala, we everywhere you go, you will get the jeera water, jeera kavala. So like that, the CCFT, and I started seeing that when patients started taking this, their tendency of acidity has significantly reduced. So this is one way to look at it. And Shitali Pranayamam, Go Gridam, and Sweet Dadimam. So Apatyam, empty stomach coffee. Whenever you see migraine patient, they say that the first thing that they have in the morning is a black coffee or a heavy coffee. First thing after they get up, tell them they have to get rid of it. Maybe after 1 hour, maybe with little bit of oat milk, or best is to tell them to give it up. Then extreme heat, if they are exposed to that, it is not good. Alcohol is severely no. Then sour fermented excess food, and then skipped meals. Make sure that they don't skip meals, because every time you see somebody with acidity, the moment they skip meals and then they have it something with severe hunger, then this will trigger this. Then coming to kapha protocols: warm fluids, light food, dry environments, trikadu, shunti, tulsi, all of this will help for them. And active vyayama, it is very important that they move, but not too much in the heat and too much of sweating. It should be done in the proper way, to ardha shakti. Vyayamam should always be done in ardha shakti. And apatyam, cold. And also I forgot to mention, there was a patient who came with a migraine, and she was an athlete, and she has a tendency to over exercise. Sometimes over exercise leads to double, it leads to kshaya avastha, and that can also lead to migraine and other problems. So we have to understand where are they going excess depending on their prakriti and vikriti. And apatya, cold drinks, heavy dairy, day sleep, excessive oiling, curd at night, these things have to be minimized. Now coming to vata protocols: patya avastha, regular warm meals. Ghritam is very important. Pada Abhyangam at night, Brahmari Pranayamam, old red rice, and Mudga. And this is very important. Then fasting, dry. See, whenever you see somebody suffering too much of Vata problems, this intermittent fasting, all these kinds of fasting will backfire for them, because their body is depleted. At that time, fasting is not helpful. Then late nights, cold wind, AC overuse, Vega Varoda. Next. So these are some of the follow-up measures that you can do. Absolute headache days versus severe migraine days per month. And then frequency of acute or abortive medication use. Then the MIDA score. This is the Migraine Disability Assessment Score. You can get it, and this will give you a lot of understanding. Like how is the quality of life? But you'll see a lot of similarity to the personal health questionnaire, the 9 questions that happens. Then headache impact test square. Then pain intensity, to what extent is it, and then systemic biomarkers. Then you understand what are the things that are triggering that: sleep quality, latency, awakenings, bowel regular bowel regularity, acidity, regurgitation, post meal bloating, menstrual rhythm, and the PMS patterns. Then rhinitis frequency, all of this, stress load, mood, all of this, these are the things that you can measure in your consultation. See, what does it mean to have successfully treated? Fewer attacks, lower intensity, faster recovery, reduced reliance on acute medication, and restored life function, and sustained at 6 and 12 months. This is a classic example, classic definition if you have treated a migraine patient very well, because this is the best you can offer. Next. So, what is a Vaidya's understanding here? Understand the criteria. Which are the conditions we can treat and we should not treat? If it is coming something which is something we cannot treat, please refer them. It's very important because it goes beyond our scope. Because at that point of time, acute attack, it's best that they need to take an emergency support. And then where are these conditions? Is it from Koshta? Is it Paitiga and Raktaja, or is it Kavaja and nature? Is it Manasika Avastha mostly? Because all of these are interrelated, but get good at understanding where are the real Nidana. And then we do the assessment, Ashtasthana Pariksha, Dasavida Pariksha. And then we realize, should we do Shamana? But don't jump into Shodhana immediately. First is always Shamana, give them certain lifestyle changes if they're coming into their OPD. But if they're coming to your IPD, usually they would have done a lot of changes and they are looking forward to have because when somebody is coming for a 2 to 3 week of Panchakarma, that means they have ready to have a change. They have reached that stage where they want to change it. That is why they are able to spend 2 to 3 weeks. So then they will be in a much better compliance to follow this. And then accordingly, Virechana or Vamana to be done. And then give them the Patyas, what is to be followed. Next. So what are the 5 pillars here? Diagnose clearly, do the Samprapti, do Shodhana wisely. Don't jump into Shodhana immediately. And wherever use the Shamana and sustain and measure. And one Shamana therapy that I always recommend, where it has really helped them, is Yoga Nidra. It is one powerful therapy. There are so many meditations. I have recorded my own Yoga Nidra, which I send it to patients. If you find some good Yoga Nidra, maybe in Hindi or your own native language, you can send it to them. It really helps them to calm down when it comes to their migraine. So that comes to the closing part. Thank you.
Thank you, sir. Now I request if anyone having any doubts, you may please ask to sir.
Doctor Saab, very, very thanks. Very nice and good presentation.
Thank you, sir. Thank you.
अब आप थोड़ा हिंदी जानते हैं, थोड़ा हिंदी?
My Hindi is not so good, sir.
बस थोड़ा समझ तो लेते हैं ना?
I can try, sir. If somebody
अच्छा,
can
ये
help me to
बताइए कि
translate.
ये पित्तशिराशूर में हम स्वर्णसूत शेखर वगैरह दे सकते हैं? स्वर्णसूत शेखर है, मुक्ता पिष्टी है, कामदूधा, जो पित्तशिराशूर है, माइग्रेन पित्तश, यदि उल्टी वॉमिटिंग की उसकी इंसेशन होती है उसको, तो उसको आप क्या देते हैं? आपने बहुत सारी दवाएं बताई, लेकिन संक्षेप में बताइए कि प्रैक्टिस के लिए काम कर सकें हम लोग.
No, those are very good medications. Those are fantastic. Just that in Kerala, we don't prescribe them. But Sudhsekar Rasa, I've seen patients getting fantastic results because of that.
Okay, okay.
They are very good. No doubt in
Okay.
that.
Okay, thank you.
Do we have any other questions?
Excuse me. It is a very elaborative description and management. Of course, I joined a bit late. Nowhere you have mentioned about Surya Varta. Have you mentioned about Surya
Yes,
Varta?
I did mention Suryavarta, sir.
Oh, sorry, because I joined later.
No, I did mention about all the 11 Shiro Rogas, Suryavarta and Ardhava Vedgam. All this was also mentioned there.
Okay, thank you. The Surya Varta, the correlated with which modern condition?
So I'll show you that slide, sir, so you understand. So, Sandhya, can you go back to that slide? Now, as the word Surya Vartas, it's a migraine that is related because of sun, exposure to the sunlight.
Yeah.
And how we can correlate it when somebody is having photophobia.
Mm-hmm.
So here you will see Surya Varta, sir. Rises with sun, peaks at noon. Diurnal, photogic, like photic triggered, like when there is too much exposure to bright light. It could be sunlight or it could be even in home light.
Yeah.
We have one nurse. We had a nurse who was saying that because she works in ICU and the light was too bright, that led to this, and she had to wear sunglasses inside her work.
Okay. Thank you. Thank you.
Welcome, sir.
Thank you,
And
sir.
sir, just that question. It's not necessary that we have to relate Suryavarta with migraine. I've seen patients who have nothing to do with migraine, but exposure to sunlight can create headache, and just by avoiding that, it will change. So I would put it somewhere in that category, that there is a possibility of correlation, but not entirely clear.
Thank you. Thank you.
Thank you, sir. Now, on
Welcome.
behalf
हेलो
of the, yes, sir.
हेलो सर, मैं प्रश्न पूछना चाह रहा था वैद्य एस.एन. पांडे उज्जैन से कि वमन और विरेचन कर्म आपने बताया है, वमन कर्म विरेचन शिरोरोग में, तो ये वसंत ऋतु और शरद ऋतु में ही कराना चाहिए या वैसे भी करा सकते हैं?
See, those are the ideal times, but we have done even in Grishma Ritu. To be frank, I
Yeah.
have done Vamana even in Grishma Ritu, but maybe I won't do, maybe I might do a Mridu Vamana. Maybe I will reduce, in some conditions, I won't be giving them Madana Phala, I will just do it with Yashti Madhu Fanda. So you have to look at the situations and accordingly give, but even though the Ritus are the perfect times, but not every time it is possible.
Yes. Okay, thank you, sir.
Welcome.
Do we have any other questions?
See, Doctor, I have sent you the presentation. You can share this with all of them.
Yes, sir. Yes, sir.
Thank
Thank you, sir. Now, on behalf of the organizing committee, I would like to thank Dr. Vignesh Devraj, sir, for delivering such an insightful lecture. I would like to extend my sincere gratitude to our mentor, Vaidya Devin Tribunaji, President of GB RAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Koteja sir, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express our heartfelt thanks to all the gurus, Shishya, and other scholars for their presence and active participation for making this webinar a successful one. Thank you, sir.
you, Doctor.